Hey friends, I'm Dr. Molly. I'm a veterinarian near Nashville, Tennessee, and this is a show for people who love their pets, like to laugh, and realize that life is hard, but dogs and cats help. I love veterinary medicine. I'm probably already obsessed with your pet, and I want you to understand more about both of those things. So welcome to the Dr. Molly Says podcast. Hola, friends. I am just sitting here. It's a gloomy day outside. Had a storm last night, and I'm excited to talk to you all about a disease this week. We're going to do another disease-specific episode, and we're going to truck along with another endocrine system disease, which is diabetes. And this is a big one. A lot of you have requested that I talk with you through diabetes, so that's what we're going to do today. We're going to have a long conversation about what diabetes is, what it looks like in dogs versus cats, how we manage it, how we treat it, and just what that looks like. Once again, I think it's really important that pet owners really understand what's happening when their pets are sick and why. And diabetes is a complicated one, but I think it is a really important one to break down and help you understand. So that's what we're going to do. But first, I have a hot take. And I posted about this on my Dr. Molly Says page, so you may have seen it. But if you missed it, I made a post. It's like a 3-minute long, 2.5-minute video of me talking about what I call breed to home mismatching. So the reason I made that reel is because I've just had several conversations with different clients the last few weeks about behavioral, mostly issues in their dogs. And the common thread I see in a lot of those patients is that the type of dog breed that I'm talking about with a client is in a home that doesn't provide that dog with the mental and physical exercise that it really needs. A package just got delivered. And, you know, all of these owners are very well-intentioned dog owners. And some of them rescued their dogs. Some of them bought their dogs from breeders. But all of these dogs are different breeds that really were created to work to herd livestock or to protect livestock. Australian Shepherds, Heelers, Great Pyrenees. These are all breeds were specifically created to have a very important and very strenuous job, physically and mentally. And I think we all as veterinarians, there's a lot of really good feedback on that post. We see this, right? We see dogs in homes. Australian Shepherd is the breed I use as an example. They're really high energy dogs who need to do something. They need to use their brain. But they're fluffy, right? And they're really cute. And sometimes people get these dogs just because they see an Australian Shepherd. They're like, I love how that dog looks. I want that dog. And so they find a breeder. They go buy that dog, or they see it in a rescue, they go adopt that dog, and then they expect that dog to be able to just kind of hang out at home all day because they're working or whatever, and not really get any significant exercise or mental stimulation and be okay. And in a lot of cases, not all cases, those dogs are not going to be okay. They have behavioral issues. They get overweight easily when they're not exercising. And so I just, it's public service announcement that it's really important to look into the type of breed you're buying or adopting. A lot of people get heat for buying dogs from breeders. And I think if you've been listening, you know how I feel about that. There's definitely a time and place for that. And we want to be careful about what breeders we buy from. We don't want to support a lot of breeders that are out there, but people get heat for that. But then we need to hold rescues accountable as well. There are dog rescues can be a business, and not everyone that is in dog rescue has the best of intentions, and not everyone that it works in dog rescue or runs rescues is doing their due diligence to make sure these dogs, 1, are adoptable, and 2, end up in homes where they will be best served. And so it's also the adopter's responsibility to make sure they're adopting the kind of dog that would do well in their home. So anyway, if you didn't see that post, check it out. I talked about it more, but just do your research. Whether you're adopting or buying a dog, make sure that breed is suitable for your home and your home is suitable for that breed. So don't buy a Heeler or don't adopt a Heeler or an Australian Shepherd or a Border Collie, if that dog cannot get a lot of exercise. Walking that dog a couple times a day is not exercise. That is not exercise. That's just like living. I'm talking strenuous exercise, as well as mental activity, mental gymnastics. They need to figure out, they need to problem solve. They need to do a puzzle. They need to figure out how to open something. They need to go look for something. There are ways to do those things. If you live in a high-rise apartment, there are ways to fulfill the needs of an Australian Shepherd or a Blue Heeler in a high-rise apartment. It just requires a lot of commitment on the owner's part. So that's my hot take. I think we would solve a lot of issues in the clinic and at home, behavioral issues, if we were more careful and diligent about matching the right type of dog with the right kind of home. Okay, that's my hot take. Let's talk about diabetes. So diabetes is a big, scary disease. And anytime I diagnose diabetes in a patient, part of me dreads the conversation with the clients. I like to talk about it. It's an interesting disease, and I actually like to talk through complicated things with clients, but I just know it feels overwhelming and a little scary when we do that. So I'm hoping that talking through it here will be a resource for some of you, maybe one day or now, if your pet is diagnosed with diabetes. So let's talk about what it is. So diabetes in our pets can be very similar to what you think of when you think about diabetes in people. So there are basically two different kinds of diabetes in our dog and cat patients. Just like in people, there's type 1 and type 2 diabetes, right? So let's talk about the different players that are participating in diabetes, okay? So diabetes has to do with blood sugar regulation, right? So persistent high blood sugar, for one of a couple different reasons, is how diabetes happens. And if you didn't know, blood glucose is regulated by insulin. And the body should naturally produce insulin. The pancreas, that fun little organ we've talked about recently, has what are called beta cells, and those are responsible for producing insulin. And they release insulin, and it should be released into the bloodstream from those cells whenever blood glucose starts to spike in the system. Okay, so when we eat a meal, that causes when our pets eat food, that causes blood sugar to go up. And so those beta cells release insulin. What insulin does is it is basically the key that unlocks the body's ability to take up glucose into tissue. So muscle, fat tissue. It says insulin basically tells everybody, all right, there's high blood glucose. Everybody needs to take in some blood glucose. And blood glucose is very important. It fuels a lot of bodily functions. But if it's too high in the bloodstream, in the system, it can cause a lot of problems. So insulin can be deficient. So diabetes happens when blood glucose is not being absorbed into the tissues. And that can be because tissues are resisting insulin, or it can be because those beta cells are either not working right or they are not existent. And so there isn't even insulin available. And this can, over time, cause that blood glucose to be higher and higher, persistently higher, and then that causes a lot of problems, right? So high blood glucose levels cause a lot of different things. It can cause blood glucose to be dumped into the urine. So the body is very smart, and the body uses all different organs to try to regulate all of these things, right? And so extra blood glucose can be dumped by the kidneys into the urine, but that can lead to other problems as well. So when a dog or a cat has diabetes for one of a couple different reasons, what their symptoms are can be similar. So both of these animals can be drinking and peeing more than normal. They, at first, especially cats, can seem really hungry, and then over time they get more sick and they don't eat. They can lose weight. They can be lethargic. They can vomit. Cats can have some weird neurologic changes and have a weird way that they stand. And dogs can just start to feel bad. So they can be drinking and peeing a lot. They eventually a lot of times stop eating. They can actually lose weight because of diabetes, and they just don't feel good. And eventually they get really sick, which we'll talk about in a minute. So I mentioned that there are kind of two types of diabetes in our pets. And so it's similar to people, but we have one type of diabetes that's caused by actual insulin deficiency. There is not enough insulin in the body. And this is what's more common in dogs. And this is usually secondary to loss of those beta cells. It can be an immune-mediated process. So an immune-mediated condition destroys those cells that help release insulin. So we just don't have enough insulin to regulate the blood glucose. Another thing that can happen, this can be a secondary problem after a dog has had chronic pancreatitis. So or severe pancreatitis. Remember, we talked about pancreatitis. The pancreas is where those beta cells are, and constant or really severe inflammation of the pancreas can actually destroy its tissue. It's a small organ to start with. And so that destruction can lead to beta cell destruction and loss. And so we just don't have enough insulin. So dogs that get diagnosed with diabetes usually are insulin deficient. And so once we diagnose them with diabetes, they will always have diabetes and we will always have to manage it. Now, cats are the weirdos per usual, and they can actually have diabetes that's secondary to beta cell dysfunction rather than deficiency. So it's not that they don't have them or they can't have insulin. It's that they either have tissue insulin resistance, so their tissues are not uptaking insulin like they should, or their beta cells are not working properly. And obesity is a common cause of this. And so insulin resistance actually leads to that beta cell exhaustion and dysfunction. So the good news about this and why cats are weird and different is that we can actually, if we diagnose diabetes in cats early on and we get them treated, there is a large chunk of these cats that can actually go into remission. So we can actually reverse their diabetes, which is really important and really cool and really important to understand, because this is why, cats don't get to the vet as much as dogs do in general. And this is why it's so important that we're keeping an eye on our cats, we're noticing these clinical signs, and we're getting them checked out by the vet, because so many diseases, the earlier we find them, the better we can treat them. So, like I said, cats can go into diabetic remission. There are different studies on this. There are a lot of different factors involved in this. We're going to get into them. As far as what percentage of cats can go into remission, no one agrees, no study agrees, but the percentages range anywhere from like 30 to 60% in different studies of cats can actually go into remission. So that's a significant population of diabetic cats, and it's why we want to get them under control as soon as possible. There's at least one study that shows that maybe cats that go on certain canned diets are more likely to go into remission. But a lot of cats with this type of diabetes are overweight. They're obese at the time of diagnosis. And so weight loss is a really big focus in these cats. We are going to treat them for their diabetes with insulin, which we'll talk about. But we also focus just as much on weight loss. We put them usually on high protein, low carbohydrate diets, treat any concurrent diseases they have, and try really hard to get them into remission. And it's very, very cool when that happens. There are some dogs, I do want to note, that can have diabetes because of insulin resistance. That's going to more likely be dogs with Cushing's because of their underlying Cushing's. And it is somewhat common for dogs to have both Cushing's and diabetes. And this is a very complicated kind of case. Dogs that have Cushing's and diabetes, they are not fun to treat because it can be a chicken or the egg situation. And oftentimes we will try to treat both at the same time. Sometimes that works the best. But I just did want to note that sometimes dogs can have diabetes secondary to insulin resistance because they're Cushingoid. There is a rare type of diabetes or reason for diabetes in cats where they have this underlying problem called acromegaly. It's a pituitary issue. It's very rare. I've never diagnosed it, but just thought I would mention that can happen, especially if a cat is diagnosed with diabetes and just really can't get them controlled. That is something to think about. And that is something an internal medicine veterinarian is probably going to diagnose and talk to you about. Okay, so how do we get to the diagnosis of diabetes in patients? So most of the time, cats and dogs, one very common thing owners are going to notice is increased thirst and increased urinating. PUPD, we call it. If you've been listening to this podcast, this is a clinical sign of a lot of diseases. So just PUPD does not tell us that a pet has diabetes. Sometimes in cats especially, we'll have increased hunger, but they're not maintaining or gaining weight. This can happen in dogs as well. Cats, like I said, can have some neurologic changes where their back end, the way they hold their legs is abnormal. And so dogs and cats, if we suspect diabetes in any way, we're going to do some baseline testing. So we are going to run blood work and we measure blood glucose when we run just regular blood work. And then we are often going to run a urinary test, so a urinalysis, and we're going to see, is there bacteria in the urine? What's the concentration of the urine? And then is there blood glucose or is there glucose in the urine? So we call that glucosuria, glucose in the urine. And we are going to look at that. And then, like I said, look at their blood glucose levels as well. So something that cats do, because again, cats are weird. When cats are stressed, their blood glucose can spike pretty high. And so sometimes higher levels of blood glucose in cats can trick us because it maybe looks like diabetes, but it can be stress. And so if we have cats who are worried about diabetes, that blood glucose is a little borderline, we do have a test called fructosamine. Fructosamine is a blood test that can kind of give us an average of blood glucose over the last 2 to 3 weeks. And so that's something your vet might recommend in a dog or a cat to get an idea of what has our blood sugar been doing the last few weeks. There's other tests we can look at to sort of narrow this down. We obviously, if there are changes in blood work otherwise, we want to rule those things or investigate those things, rule out other diseases. But high blood glucose, especially if it's persistent, especially if that dog or cat has not eaten in a few hours and their blood glucose is high, a high fructosamine and glucose in the urine that coincides with high blood glucose. All of these things tell us that these patients have diabetes. So it's a pretty straightforward diagnosis. So diagnosing diabetes really is not that difficult. Sometimes we diagnose diabetes because a patient, dog or cat, has presented to us in a very serious, often life-threatening condition called DKA. And DKA is diabetic ketoacidosis. And this is a condition that, like I said, can be very, very fatal. This is usually because of diabetes that's been untreated for a while. These patients have been PUPD. They've been drinking peeing a lot for a while. They get progressively more and more dehydrated. Often these dogs have lost weight and lost muscle mass because of this ongoing diabetes. And this happens because their body is really not able to get the glucose that it needs to function. And so they can actually shift into the body can consume its own fat and protein for energy instead of that glucose. And so, like I said, a lot of diabetic patients will eat a lot at first, and then they start to feel bad, they start to get sick, and then they can stop eating. And patients that come in with DKA are often not eating, they can be vomiting, and they can be very, very sick. And so these patients, they can't get glucose, their body's mobilizing fat and sometimes protein. This leads to ketone formation. And ketones, when they accumulate, can cause a lot of damage. Metabolic acidosis is the one thing that causes a really big problem. And we get some major electrolyte shifts in the body. And then as DKA worsens, this becomes, like I said, a huge emergency. They have these electrolyte shifts, particularly in their potassium, can be very, very serious and cause fatal side effects. So when we see patients with DKA, if they come in really sick, like I said, these are very critical patients. ERs ER doctors, criticalist doctors manage these patients a lot because they can collapse. They can become hypothermic because they're just so sick. And they have to be managed very carefully, very aggressively. They're usually going to be hospitalized in those severe cases for sometimes several days. We have to get their blood sugar regulated. We have to get their electrolytes regulated, and they're gonna get a lot of treatments, and it's very serious. So that's the eventual thing that can happen when diabetes isn't treated. There are a lot of other things that happen in the body with untreated diabetes, but that's basically like the end problem that kills patients that have diabetes that's not treated. And prognosis with DKA it's not wonderful. So mortality rates range anywhere from like 25 to 35%, depending on how severe it is. And recurrence can happen if we don't get their diabetes treated. So that's basically worst case scenario with untreated diabetes. So we have to treat our patients with diabetes. If we diagnose diabetes, sometimes I've had a few times where a client's been like, I don't really want to treat this. And that's just really not a kind or fair option. And so treating diabetes in both our cats and our dogs is important and necessary. So how do we do that? So it's important for people to know, and this is a conversation I have with clients anytime I diagnose diabetes. I sit down with them in the room and I say, look, this is a scary diagnosis. It can feel overwhelming. We're going to have to talk about a lot of things. I'm going to try to help you digest things a little bit at a time. But this is a lot of work for both cats and dogs. It's a lot of work. There's a lot to keep up with. It's not easy to go out of town when you have a patient or a pet with diabetes. It's a lot of work. But these dogs and cats can live fairly normal lives, have good prognosis, normal lifespan, if we can get them managed well. So the mainstay of management for dogs and cats, particularly dogs, is going to be insulin, because dogs, like I said, dogs don't have really reversible diabetes. So they're going to go on, we're going to give them insulin to help their body regulate their blood glucose. And they're most likely going to need to be on that for the rest of their life. So let's start with dogs. So there are different types of insulin that we can give dogs and cats, and most of your veterinarians are going to want to start with a veterinary insulin product called Vetsulin. This is what we call porcine lente insulin. And Vetsulin is great for a lot of reasons. There are alternative insulin options, but pretty much most veterinarians are going to start with Vetsulin. For me personally, I am going to start a pretty low dose of insulin. The big things and every veterinarian does this differently. Okay. I think this is an important thing to note, that diabetes is one of the diseases where there's just going to be a very big spectrum of how your veterinarian approaches treating it. Maybe the dose that they use for insulin, the way they want to start doing things, the way they want to monitor. There's a lot of variation here. So there's not necessarily 1, 2, 3, 4, 5 exact right ways to do this. There are better ways, and there are some great guidelines and resources for veterinarians based on research and science and input from lots of very smart internists. So there are guidelines that veterinarians can follow, but I try to follow the AHA guidelines for diabetes management. And so in dogs, we're going to start with a lower dose of insulin, and cats as well, and work our way up. We never want to give too much insulin. That can cause low blood sugar, and we don't want that. Hypoglycemia is what we call that. That can cause other problems. So we usually start at a lower dose and work our way up. All right. So most dogs that go on insulin, they're going to get the same dose of insulin at first, morning and night. It's really important that we time that as close to 12 hours apart as possible. That's because the way that insulin works. So they get insulin. They should have eaten already when they get a dose of insulin. So we want insulin to start taking effect right about the time that we have a blood glucose spike in the bloodstream, right? So we want those things to happen together. And then that insulin is going to, remember, help the tissues in the body uptake that glucose. So there's not too much in the bloodstream, and the body gets what it needs from the glucose. And so that starts to wear off. somewhere between those two time frames, the 12 hours that we give. And so when I show people what blood sugar does in response to insulin, it can be sort of a bell curve. So our blood sugar spikes when we eat, and then the insulin helps that go down, 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 down. And then the insulin starts to wear off. And so then the blood glucose starts going back up. So it's a upside down bell. So it's like a dip. And that low point where the blood glucose gets as low as it can because the insulin's taking its full effect, we call that the nadir when we are looking at a graph of what blood glucose does. And so then it's going to start to go back up, and then we're going to feed a meal. It's going to spike again. We're going to give insulin again. And so then that blood glucose starts to go back down again. And so that's the pattern of blood glucose that we see, especially in our patients that we're giving insulin to. So we're going to usually start at a low dose. We're going to want to monitor, see what that blood glucose is doing, and then we adjust our insulin dose accordingly. There are a lot of ways to monitor blood glucose. For a long, long time, what we had to do was what we called blood glucose curves. So we'd start a dose of insulin, and then we'd have a dog come back in a couple weeks or a week or a day, depending on the doctor, and we keep them in the hospital for the day, and we get a blood sample every couple of hours, and we literally graph that and watch what the blood glucose is doing. And the cool thing is that now, because of modern medicine, we do have some options to look at continuous blood glucose monitoring in our pets, like people. So there is a human glucose monitor. It's called the Freestyle Libre that veterinarians are now using to monitor blood glucose. So it's a little sensor monitor that gets put on the skin. It has a little probe that goes under the skin, and it transiently measures blood glucose in the bloodstream. And this can go in dogs and cats. And so I personally love using Freestyle Libres because one, nobody really likes doing blood glucose curves. And two, I think if we can get results, they can be more accurate as far as showing us the trend of what our blood glucose is doing, because pets get to stay home. They're not stressed like when they're at the vet clinic getting poked every couple of hours. And it allows us to see what's happening for 2 weeks. So those sensors last for 2 weeks. For most of those. So cats and dogs, we can do that for both of them. And sometimes that's not an option or it's not working well. And so we will do those blood glucose curves. And we're going to check those periodically, especially at first. If your pet first gets diagnosed with diabetes, they're going to be getting that monitored pretty frequently. And anytime we make a change in the dose, we're going to monitor that again and see where it goes and then adjust accordingly. In cats, the insulin we use first is not Vetsulin usually. So PZI Prozinc insulin is usually what a lot of people start there, or Glargine called Lantus. So those are two different types of insulin that are used more commonly for cats. But again, usually your vet's going to start at a low dose. You're going to give it every 12 hours after a meal is really, really important. And cats, especially the first few months after they get diagnosed with diabetes, monitoring is so very important, because if they do go into remission, then we want to know that as soon as it's happening, because we don't want to actually have too much insulin on board and them get hypoglycemic because they're not diabetic anymore. They don't really need insulin anymore. And so getting to remission can happen, but it does require a lot of commitment and time and monitoring and testing in the first few months. So insulin is the mainstay of treatment for both dogs and cats. Like I said, dogs are going to be on insulin for the rest of their life. Some cats will as well. Some cats will go into remission and not need insulin anymore. Diet can play a really big role in diabetes for both dogs and cats. So what they eat can be a little bit different. There are prescription diets that work really well for these patients. In dogs, what is shown to help with management is a high fiber diet. So these diets have complex carbs, and this can slow the absorption of glucose or of the food. And so can, not glucose, slow the absorption of everything. So we have less dramatic glucose spikes. And so this can help with management of blood glucose levels. Consistency in feeding time for both dogs and cats is so important. So you really want to time 12 hours. We feed a meal, we give insulin, and we wait 12 hours to do that again. Unfortunately for these patients, giving them treats in between can really mess with their management. And so a lot of times these patients need to be on a very strict diet and schedule with their meals. Cats, we usually get them on a high protein, low carb diet. Weight loss is really, really important, especially in these insulin resistant cats. And we do think it's good to avoid high carb dry foods. There's a lot of evidence for that. So diet, like I said, can in cats help them get into remission, and in dogs, it just helps with the management. So if you have a pet that's been diagnosed with diabetes and your vet hasn't talked to you about a specific diet, it's definitely something I would ask about. Most of the time, it's a good idea for both of those patients. So what to expect if your pet gets diagnosed with diabetes? So initial stabilization, I always tell people you have to be patient. We have to be patient. This is not a miracle overnight fix. It can take weeks to months to really regulate. You're going to know your vet and your vet office really well. You're going to be there a lot, and you're going to chat with them a lot, and you're going to get very used to all of these things. In the long term, if your cat does not go into remission, your cat and your dog are probably going to be on insulin forever. And the cost of these things can add up, right? So insulin is not necessarily cheap. And you have to buy needles, specific needles to go with the insulin. You're going to, like I said, be at your vet a lot. Your pet might be in a prescription food. And then obviously diabetic dogs and cats can go into DKA. And so planning for possible hospitalizations is probably wise. So like I said at the beginning of this, it's a big conversation we have with clients. It's a big commitment, and there's a lot involved and a lot of possible complications. One thing we do worry about, especially at the beginning when we're getting our patients regulated, is hypoglycemia, so low blood sugar. And this can happen if they don't eat or don't eat enough, and then they get insulin and it's too much and it makes their blood sugar get too low. This can happen in cats if they go into remission and they're still on the same dose of insulin. And we do see this happen sometimes. Dogs will get double dose with insulin. Mom gave it. Dad thinks she didn't give it, so then he gives it, or vice versa. And I always tell people, if you have a diabetic patient, it's always good to have some type of glucose source at home. Like honey is a great one, where if you feel like your pet might be getting low blood sugar for one reason or another, take some honey. You can also use like Karo syrup, rub it on their gums just to get some sugar in them really quickly. Signs of low blood sugar, just so you know, are just sudden lethargy. These dogs can actually have seizures. They can vomit and just be really out of it and lethargic. Eventually, low blood sugar can cause a huge problem. It can cause seizures and coma, but that's if it's untreated and not recognized. But it's important if you have a diabetic pet to know what that looks like. So like I said, there are concurrent diseases that can go hand in hand with diabetes. Pancreatitis is one that can actually lead to diabetes. There are some interesting cases of chronic pancreatitis that leads to diabetes in our patients. Cushing's is another one, can lead to insulin resistance, and so can go hand in hand with diabetes. And in cats, like I said, acromegaly is the weird thing, but yeah, diabetes it's a big deal. I always try to make my clients feel justified or valid in feeling stressed about it when we diagnose it. But I think it's also really important to understand that it's doable. You can do it. Giving insulin is scary for people. It's a teeny, teeny, tiny needle. It goes just under the skin. It's just a sub-Q injection, and it's a tiny amount. And it seems scary for a lot of people at first, but it's such a tiny needle. A lot of pets don't even feel it. They get used to it. They get really good at it, and you get really good at it. And it can become a very routine thing, just part of your routine, and doesn't feel so big and scary anymore. So that's what's happening when our patients have diabetes. That's very big picture, how we find it, how we manage it, how we treat it. And yeah, it's one of the more kind of like, I would say, big deal things we diagnose and chat about. Some diabetics are really, really hard to manage. And I think it's important to understand that GP veterinarians should be able to diagnose diabetes, and they should be able to initially attempt to manage diabetes. I do think it's important for pet owners to know that there are a lot of cases of diabetes where it's appropriate to get referred to an internal medicine specialist. I definitely refer diabetic patients often if I'm having a hard time regulating them. There can be different reasons for that, and internists are better at figuring those out. And then they're better at making very kind of unique, tailored plans to managing diabetes in pets that are hard to manage. So I think that is another takeaway I want to make sure people hear is that, if you have a pet with diabetes and you and your GP vet are having a really hard time managing it or getting it under control, then it might be time to chat about getting referred to an internist. There's no shame in that for your vet. There's no, that's a good thing. And it often costs more to see an internal medicine specialist. But if they can get your pet regulated more quickly, then it won't cost more because you won't be going to your regular vet as often. So I hope this is helpful. If you have specific questions about diabetes, send them my way. Another thing is we are talking about diabetes mellitus. There's another type of diabetes that we call diabetes insipidus that I would love to cover in another episode because it's a cool disease that I've diagnosed a few times, but much more rare than diabetes mellitus. So I hope this was helpful. And like I said, send me your questions. Make sure you're following us. Dr. Molly Says is my handle. Dr. Molly Says Pod is the podcast handle. We're on YouTube. If you're listening to this, you can watch it if you want to. Feel free to send us questions at the link in our bio or shoot me a DM. And I will see you next week on the Dr. Molly Says podcast.